Hi everyone, I'm really excited to talk about our newly arrived Motiva smooth round implant. We also have the ergonomics. For now I'm going to talk about the round implant because it will help me demonstrate some of the features why this is such an amazing technology. We haven't had a new device in the breast aesthetics world in 20 years, and I will bring lots of videos about the history of breast implants, the good and the bad, and why they've been a little bit controversial through the years. But what you'll notice about this is that it's not quite super clear. It's got what we call smooth silk texture. It really does feel a little velvety. In studies around the world, this has been shown to be less inflammatory and less prone to infection. And the data shows less than 1% capsular contracture rate and less than 1% infection rate. So we believe that your body will understand, even though it's a foreign body, that this is going to promote less of an immune response. So that's great news for our patients who've had concerns about that. Number two is a true monoblock technology. The shell, the filler gel, and the patch in the back are all welded essentially together. I got to take a tour of the factory. It was really cool to watch it. So this will act as one unit in your body. The third is this bluish color. It might not come out great in the video, but it's a visual indicator that if their blue is disturbed, that there's a problem with the device. And lastly, the gel itself is 6th generation, super cohesive, even on its side, less rippling. What's great about that is that we can potentially use it more above the muscle and even in thin patients who don't have a lot of tissue, you'll be able to maintain a nice natural look. Finally, there's two different cohesivities, smooth round and ergonomics. Smooth round will have a little bit more integrity to it, especially when it's in you. Anatomically, you will see a little bit more of the upper pole fullness. The ergonomics, when it's in your body, will promote more of that teardrop shape, as you can see. Lastly, what's interesting about this implant for an equivalent older implant, both 400 milliliters, it seems to us that there's a little bit less volume here, even though it's 400. And what's happening here is, I don't know if you look when it's flat, around the base there's a gentle upturn. So if you do that 360 degrees, you actually remove some of the volume. You maintain the same projection this direction, which is what an implant is designed to do. Yes, it fills a pocket, and yes, it gives you volume, but the idea is to bring the breast forward. So you can remove some of the volume, make it a little lighter, and achieve equivalent projection. Why does that matter? The truth is that this is a little bit of weight in your tissue, as is this, right? And weight and gravity over time pulls and stretches out your tissue. So if we can use a slightly smaller device, over time, we will have a little less trauma to the tissue and a little less weight on the tissue. These are designed to be ergonomic, move with you, respect your tissue, preserve your tissue, and that's why we're so excited. You all know in women's health that we've been long neglected in terms of research and development. Just studies alone on women's health have been severely underfunded. So kudos to Motiva for bringing this implant to the market. We're one of the first practices that can bring it here in Washington, D.C. We're so excited. We believe in this technology. We want to share it with you. So schedule an appointment and we can talk about your aesthetic goals and whether Motiva is right for you.